Zoonosis is a disease transmitted between animals and humans. Those with lessened immune systems are called immunocompromised. Those that are most known for being immunocompromised are babies, pregnant women, people undergoing cancer treatment, people who have received an organ transplant, people with chronic diseases, and people with HIV and AIDS. There are a couple reasons you should care about zoonotic diseases. One reason is because you can catch and transmit diseases between yourself and animals, and the other reason is so you can learn how to prevent catching and transmitting zoonotic diseases. In this training, you will learn the names of some of the zoonotic diseases and how to prevent the transmission of these diseases. The first zoonotic disease we will talk about is rabies. Rabies is a zoonotic disease that is usually transmitted through a bite. Some symptoms of a rabid animal are change in behavior such as aggressiveness or friendliness, or also known as furious or dumb drooling, and change in sound of voice. To prevent rabies, you should always have your animal vaccinated, avoid handling wildlife, especially those acting abnormally, always wash any bite wounds with soap and water, and always report bite wounds. Dermatophytosis, also known as ringworm, is caused by fungus, not a worm. It is spread through direct contact and most commonly seen in immunocompromised animals. Both cats and dogs have signs when infected with dermatophytosis. They are usually seen as lesions on the face or paws. For dogs, their symptoms usually include hair loss and pruritus. When the fungus dies, it usually leaves the appearance of a ring. To prevent dermophytosis, you should practice good hygiene and wash your hands after having animal contact. Another zoonotic disease is toxoplasmosis. Toxoplasmosis is caused by a parasite and is spread by oral ingestion. Although this disease is rare in healthy people, toxoplasmosis is a concern for pregnant women as it can cause miscarriage and birth defects. This disease is spread through ingesting eggs from fecal contaminated soil. To avoid toxoplasmosis, you should wash your hands after handling feces and wear gloves and protective gear as much as possible. If you have a cat at home, you should change the litter box daily. Cat scratch fever is a zoonotic disease that is caused by bacteria and spread to humans through cat scratches or bites. Approximately 40% of cats carry this bacteria. Some symptoms of cat scratch fever are a rash, blister, or ulcer. A person may also experience some swelling of the lymph nodes. Cat scratch fever usually heals on its own within 4 to 8 weeks. To prevent cat scratch fever, all bite and scratch wounds should be washed with soap and water, and proper flea control should be practiced. Larva migrans is caused by migration of immature worms in various parts of the body, and one can become infected by ingesting larvae or having direct contact with contaminated soil. This can be caused by many worm species, but is most typically caused by roundworms or hookworms. To best prevent larva migrans, practice good hygiene and wash your hands. It is also helpful to practice regular deworming of pets. Leptospirosis, a bacterium, is spread through contaminated water or soil, primarily through urine. The best preventative for humans is washing your hands. Leptospirosis is rare in cats, but there is a vaccination for dogs, and it is also effective to practice rodent control. There are a lot of transmittable diseases, and the best way to protect yourself is by washing your hands. Practice good hygiene by washing your hands regularly with soap and water. True or false? A zoonotic disease is a disease that can be transferred between humans and animals. You can be exposed to a zoonotic disease by A. Bites and scratches, B. Feces, C. Contaminated food or water, or D. All of the above. What is the easiest and most effective way to prevent a zoonotic disease? Which is not a zoonotic disease? A. Rabies, B. Fungus, or C. Mosquito bite?